people and they're going along fine, and then all of a sudden they found themselves in a pit and they can't get out. This woman says the more focus state leaders place on the issue, the better.
Everybody has a path. Rachel Santizo's has been harder than most.
I did end up losing my kids, and I ended up homeless on the streets.
It all started so simply.
The doctor prescribed them for me for fibromyalgia.
Lortabs.
Just to get out of bed, I would have to take a handful of them, 10 of them to be exact, of the highest dose.
She was addicted before she knew it.
I bought anything I could get my hands on. And then I had a friend introduce me to heroin. And once you start using heroin, that's it.
Santizo's story is growing increasingly common in Utah.
There's a tipping point where what is being prescribed is pushing people to the street.
Police, prosecutors, doctors, and patients recently gathered on Utah's Capitol Hill to address what has become a crisis of opioid abuse and overdose deaths. In 2014, an average of 24 Utahns died every month of prescription opioids.
Probably the first comment we hear from our patients that when they come into our clinic is, "I just want my life back."
Community leaders are trying to find answers while striking a delicate balance between pain management and addiction.
We need to have more, better, and new treatments for chronic pain.
There's so many times that I should have overdosed.
Nobody knows the dangers better than Santizo, who never expected to find herself on the path to addiction.
I didn't know what addiction was. I was the least educated about addiction, even though I was addicted to them.
Now clean for 4 years, she hopes her story helps others understand what can lie ahead.
A human life is priceless, and it's a simple thing as educating.
The legislature last year passed several bills that dealt directly with opioid deaths, also approved $250,000 in one-time money for an outreach program at the Utah Department of Health. Lawmakers expect to revisit the issue in 2017.